doesn't really do a lot. It's quite lazy person I've got in the studio today.
I told you I like to work.
Skincare has gone crazy though, hasn't it?
It's gone nuts. So we always think about the day is just about protection, and then the night is about either repairing something or regenerating something, and that's what you put on. We often say, eat the rainbow. So there's lots of colourful food on your plate. I don't mean Smarties.
Do not eat Smarties.
Which is what my son said to me. He's like, I'm eating the rainbow. And I was like, Skittles don't count.
No one wants to hear that. No one wants to hear about the cardio.
Yeah,
I don't want to hear about the cardio.
I think that's one of the first things you have to be as a dermatologist. Are you interested in picking your own skin? If the answer is yes, then you get accepted. Some of the advice given is absolutely terrifying. It's an absolute nonsense to say that cream's going to get rid of your wrinkles, because it just won't.
So Emma, thank you for joining me on the podcast today.
Thank you for having me.
Did you like my little song for you then?
I liked it, yeah.
So
back.
How we start this podcast is, can you introduce yourself? I have just given you a massive introduction. Introduce yourself.
So I'm Dr. Emma Craythorne, and I'm a consultant dermatologist, which means I specialise in the skin. So that's a doctor who's gone to university, does everything they have to do with medicine, and then decides to specialise in the skin. And then we spend another 5-6 years just working in the skin. And then you become a consultant dermatologist. And I work in the NHS setting, where my main issues are really things like skin cancers and how the sun affects our skin, and lasers. And then I also work in my private section of dermatology, where I see slightly more fancy versions of dermatology sometimes. And then I also have a TV show called The Bad Skin Clinic. And on that, we see very kind of extreme conditions, and we decide how we can help those people live better lives. And then I also have my own podcast called the After Hours Skin Clinic, which
doesn't really do a lot. It's quite lazy person I've got in the studio today.
I told you I like to work.
Yeah, I know. We're the same. Like, list the jobs.
And in that podcast, we talk about all of the things that everybody asks me at the school gates, or in the pub or in the park about dermatology. So it's, your typical questions of, which moisturizer is the best moisturizer? What do I need to wash my hair with? And we answer all of those kind of questions in that podcast, the After Hours Skin Clinic.
Okay. Right. What is the
need you on there.
What is the most asked question?
The most asked question is really, it depends kind of which group is asking that question.
Mums. Let's go for the mums first. For my mums who are listening to this pod.
So what mums really want to know is things like, for babies, what should you do if your baby has eczema? That is probably the number one question that gets asked. For mums of teenagers, the number one question that gets asked is, are all of these skincare things that our teenagers are buying, are they actually helpful or harmful? And then the mums themselves.
Skincare has gone crazy though, hasn't it?
It's gone nuts.
Can you actually believe it? When you were studying to be a doctor, how crazy skincare has got? Because even like, I went to my favourite brand, Space NK. I absolutely love them. But I said to the girls that work there, I'm like, the teenagers that are in here, like, have I got to start funding this for my children that they think they're going to be having the drunk elephant at 12? Like, what are your thoughts on it?
I mean, it is nuts, right? Have you ever spent 80 quid on a moisturiser? I've never spent 80 quid on a moisturiser, ever. I mean, but yet teenagers are spending that, and even teenagers, I suppose, are spending that.
But do you think it's because they're seeing that on TikTok and Instagram, and it's all about this skincare routine?
So I'll tell you my theory on where this all comes from.
I love it.
So teenagers are a group of people who have always been marketed to, from the days of where it was very skincare marketing because you have acne, and the whole idea, do you remember the Clearasil campaigns, where it was almost where it was a shame to have acne, and you needed to buy this routine so that your skin would be okay and you'd have a problem that needed to be fixed. But really, teens have always been marketed to. But what happened during the pandemic, we all started to spend a bit more time looking at our faces in front of screens, including even little teenagers.
Zooms
and Zooms. So we all got a little bit more hypercritical about our appearance. And this also kind of coincided with that rise in social media where there was, constant endless images of very filtered faces, which is a kind of unachievable goal, but still a goal that people then have nonetheless. And then that got combined with, instead of, having the right pair of jeans or the right trainers, to feel part of the in crowd, you would share your get ready with me. And this became a huge trend of people getting ready, showing what the routines were. And that really hit it off amongst these young, predominantly female teenagers and teenagers. And so these were almost being seen as like ornaments rather than necessarily skincare, because most of them didn't really understand
what they were doing
and what they were putting on. But you had to have them to be part of the gang and to feel cool and to feel included. So I think the marketing very much played on that, that need for a teenager to be accepted. And this was a way of being accepted. And, skincare is funded by big marketing. And then that marketing is to this very burgeoning group. As I think really in my mind, that's how this all happened. But I do think it's calming down a bit. I really do.
Well, it needs to. Because like you're saying, what worries me is the ingredients that are in the products that children are using on their face. And I just think, like going back to the parenting, a lot of parents now are just yes parents, aren't they?
Yeah.
They just go, yeah, let's go to the beauty shop and let's buy you the products you need. I remember that even with me, I went to performing arts school. I probably wore a little bit more makeup than your average teenager. And then that's when my mum said, why don't we get you some skincare? Then it was like, because let's take your makeup off safely. I've actually got really sensitive skin, so obviously a makeup wipe and that is rubbish for me. My face all flares up and it looks just horrible. But it's just quite scary, isn't it? I just think the world's gone quite extreme for teenagers.
I think that's really good that your mum did do that for you, because with my dermatologist hat on in clinic, and especially lots of performing children, whether they're in dance or drama, ballet, whatever, the amount of stage makeup that actually goes onto their faces, it can really have an impact on developing sensitivity and things like that on their skin. And one of the big issues is actually the makeup's fine, but you do need to understand how to take it off properly, how to moisturize that skin barrier afterwards, so that you're not going to run into these sensitivity issues that you described. So your mum was well ahead of the curve. So
thanks, Diane. Yeah, but I just think now it is quite worrying. And what you're saying, even with the get ready with me, I mean, I watch them and I think, oh God, how boring would my get ready with me be? Because I just don't really use anything. I'm quite a basic person, and even with the makeup. But look at your skin's absolutely fantastic, isn't it?
Oh,
your skin is amazing. I'm just sat here like, wow.
Thank you. But I think that if you have a very basic skincare routine, you're actually doing your skin a favor. It is not about a multi-step, several kind of translator routine. It is about sticking to the absolute basics. And it is not anything fancy. There is no secret, recipe to good skincare. It really is about a very gentle cleanser. It costs about £3. Yep. A very gentle moisturizer that suits your skin type. And then your SPF in the morning for your face. That is it in the morning. I mean, there is no other secret recipe at all. That is it. And then at nighttime, if you've got skin concerns, you might want to add, actual medicines in to help the skin concerns. But
what would be the medicines you add in?
So say, for example, somebody has rosacea, where you have redness and flaring of the skin of your face. So a bit like an extreme version of the sensitivity that you talked about. And in fact, had your mum not help you look after your skin, you may even have rosacea. Do you know? Okay. So it's about protecting your skin. So this is a red rosiness that people get of their skin. And there's medicines that we use. So we can use topical treatments like azelaic acid, or another drug called ivermectin, or another drug called tretinoin. And mixing these together, you can put those on your skin at nighttime to help treat the rosacea. Yeah. Or if somebody has acne, that's why they might want to put their acne treatment on at nighttime. If somebody's trying to, do better aging of their skin, they'd put those treatments on at nighttime. So we always think about the day is just about protection. And then the night is about either repairing something or regenerating something. And that's what you put on. But it is incredibly basic. I mean, it really is. I suppose as a doctor, I think, we are scientists and we look at the evidence of what is in the world, and the vast majority of almost everything that you see in skincare and marketing and new trends coming along is not based in any good human studied science at all. I mean, really anything. So peptides or, these are all done in test tubes. They're not done on people. The outcomes are not measured in a way that we would think of as scientists, but people can make all of these claims. But in truth, I'm not saying they don't work, but I'm just saying that there's not the science to show
Behind
properly that they work.
So do you have a lot of people come to clinic and say, I'm using X, Y, and Z products, and you're like, oh.
I mean, it is beyond crazy that you see the different kinds of routines that some people will come up with. And again, not based in science. I'm so boring. I'll just keep saying, not based in science. And I'm not saying that they don't work or they don't work for them. But for me, it's about understanding what your skin is like and understanding if there is an issue with it. How do we fix that issue with the treatments that we know work rather than guessing?
Are you seeing over the years as well, diet has got a massive part to play in skin?
So when we think about how you look after your skin, one of the most important things I always say is the skin is just one part of your entire organism. And again, this is very boring and back to basics, but really there's some very core principles that keep us as humans looking good and looking healthy. And those things are having a very good balanced diet. And that is a diet that we often say, eat the rainbow. So there's lots of colourful food on your plate. I don't mean Smarties. Which is
not eat Smarties.
Which is what my son said to me. He's like, I'm eating the rainbow. And I was like, Skittles don't count.
Taste the rainbow.
But things like that and whole grains and lots of plant-based meat is good. A very good wide variety of a diet and avoiding those very ultra high processed foods, avoiding foods that have got high sugary index, because these foods that have a high sugary index, they're not good for our skin.
No.
So that's incredibly important. Exercise is important. We know when we exercise properly. And exercise is very interesting because if you do certain strength exercises, it kind of rewards the skin in certain ways. But equally, cardio exercise rewards skin in certain ways.
No one wants to hear that. No one wants to hear about the cardio.
Yeah,
I don't want to hear about the cardio.
Watching TV and eating your crisps that's not a reward.
No.
But even sleep. There's some such interesting studies around sleep and the importance of having sleep at the right time, because when we sleep, we release a hormone an antioxidant called melatonin.
Yep.
And that's a wonderful antioxidant that restores the health of our skin while we're sleeping. And so even if you've just had one night of bad sleep, you can just see it in your skin. There's a study published in the British Medical Journal a few years ago showing this. So, and that's obviously just temporarily. But I think
you can feel it.
You can feel it for
you
sure.
You can feel your skin. Like for me, mine's like dryness that I get. But again, the gut, everything. I know that when I've been eating crap, like even if you go out and drink,
yeah,
you wake up and you're like, have I got a spot?
Yes.
Why have I got a spot? And it's because you've been out and you've been drinking. I've always been quite lucky. I've not suffered with really bad skin. But your skin does show you, doesn't it? It's like you've been out. You've been having a lovely time partying, but your skin's not great now from that.
Yeah, your skin is this measure of health that looks outwards. And also in itself, it even feeds back to you. So you imagine what you feel like when you get that one spot. Like it ruins your day. It is annoying when you've got this one spot, whenever you're not used to having that one spot. So you imagine the impact then whenever you have a very visual skin disease and it's there all the time. Think with your one spot, you're meeting somebody new for the first time, and say that big spot is right at the end of your nose and it's a big yellow head on it and you can't pop it or do anything. It's just there. And you're meeting somebody for the first time. Like think how you would feel about that. Or you're going for a job interview. Think how you feel about that. And then if you kind of imagine that exaggerated more so into these skin diseases that present on the face, the impact that has on you. And it even impacts your sleep, it impacts your stress, and then that feeds back inside, and then that
it is like
outside.
it is a vicious circle, then, isn't it?
It is, yeah.
Like with people that suffer from acne, because I get it's the circle that you, like you're saying, that it goes round and round, and you're like, the more you're worrying about it, the more stress you're causing yourself to.
Yeah, correct. I had a patient I was thinking of in clinic where they came in and they said with her acne, and she said, "Oh, my mum said it's because of the chocolate I eat." And I said, "Oh, do you like eating chocolate?" And she said, "Yes." I said, "What kind of chocolate do you like to eat?" And she's like, "I like to eat dark chocolate." Now, dark chocolate is a very powerful antioxidant. Wonderful. So I'm not condoning the chocolate that's like full of sugar. But I said to her, that's fine to just eat the chocolate. You can just eat the chocolate. Does it make you feel more relaxed? And I was like, she said, yes. And I said, Mum, let her have as much chocolate as she wants.
Do you reckon she just researched before she came in there? Was like, dark chocolate is good. She probably goes home and eats like a massive dairy milk. I used to do that when I had my braces on. I used to say to the dentist, orange juice. I just love orange juice so much. But like secretly, I'm like, yeah, I'm drinking fizzy drinks. I knew what's not going to make this brace really bad. So also, I was having this conversation this morning. What with stretch marks? Do you think some women are just prone? Because you know, there's so many like stretch mark oils and like I've not used anything, and I've not got one stretch mark, and I've never got stretch marks with any of my kids. But do you think that is just my makeup of my skin?
I do actually, yeah. I've had 3 children. I haven't had any stretch marks with any of my children. And
did you use anything?
No, I didn't use anything. That's not true. I use a moisturizer. I always use a moisturizer, and I can come back to say why. But I do think this is about the type of skin that you have. So we all make collagen in a slightly different way. Well, not everybody, but we're kind of grouped into the way we make our collagen. And some people's collagen, I mean, you can even feel this if you stroke someone's face or touch someone's arm. Some people have slightly kind of bouncier, softer skin than others. Some people have a kind of more velvety type of a skin. And other people have skin that feels a little bit tougher. And even if you think about people who have, say, for example, chickenpox. So some people, after they've had a chickenpox reaction, will have a scar that most people can't even see, don't even recognize it's there. Whereas other people might get a dip scar, or some people get quite big, stretched, obvious scars. And that is really about how our skin, the collagen within our skin, responds to a trauma.
Okay.
And it's even the same with acne scarring. Not everybody who gets acne scarring. So yes, it is really to do with the type of skin that you have. Ultimately, almost everybody would get a stretch mark if your skin was stretched enough. So, you know, if you were pregnant with, I don't know, triplets, maybe you might get stretch marks. But on the whole, it's all about how far can you stretch it before the skin breaks. And some people have very stretchy skin.
What are the most common skincare concerns that you see in children and teenagers?
So the number one that we see is eczema. That, especially if we're thinking about little kids to begin with, that would come to clinic. It really is eczema. And eczema is a condition where the skin barrier isn't functioning as well as it could do. And what I mean by skin barrier, it's the very outermost part of our skin. It's made up of a combination of dead skin cells and things like cholesterol and free fatty acids and ceramides. And if we think about it, it almost looks a little bit like a brick wall, where the dead skin cells are the bricks, and then the mortar in between is this lovely syrupy soup of the lipids and free fatty acids and cholesterol. And that is not very thick at all, but essentially that is what protects our inside body from the outside world. And it stops water from leaving our body. And it also stops those things that are on the outside, like antigens, so, you know, irritants, pollen, bacteria, microbes. It stops them from getting into our body. And when somebody has eczema, sometimes it's related to a specific mutation in one of the genes that make up this skin barrier. And sometimes it's because the skin barrier just hasn't matured enough. So when somebody has eczema, that barrier doesn't work as well. and it lets more water out than it needs to, and it lets more irritants in than it needs to. And as a consequence, the skin looks dry, it looks a bit scaly, it looks a bit red, and annoyingly, it's incredibly itchy.
Itchy, yeah.
It is so distracting, the itch of eczema, that it is kind of all consuming. And sometimes when then little ones scratch their eczema, they then break the surface of the skin more, and the bacteria that lives on the skin gets in, and it sets up a change in the bacteria safari, or the microbiome in that area, and causes more inflammation.
It's so hard though, isn't it? 'Cause how do you not get a 4 or 5-year-old to itch?
Yeah. So the number one most important thing to do is to recognize it. It looks a bit different in babies. They often get it around their cheeks to begin with. And then, from about the age of maybe 2 onwards, they'll get it behind their knees. They'll get it in the folds of their elbow. Yeah. But then they can just get it all over. But it's important to treat. And the reason why it's important to treat, it's related to other types of allergy conditions. So getting things under control from a younger age means that you're less likely to have that march on and get things like food allergies, to get things like asthma, which in themselves have different kind of problems associated with them. So it is getting in and recognizing it and treating it early. And we're really lucky of the times that we live in, because we can treat this nice and early with moisturizers. There's wonderful moisturizers around. The ones that I love are things like the La Roche-Posay Lipicar Balm, the CeraVe, Aveeno. They all do really gorgeous moisturizing creams for little ones. And after you've washed your child, you don't let them soak for a long time. Pop them in, get them clean. You don't need to use any soaps or anything like that, and bring them out, and then immediately cover them in the moisturizer, because that moisturizer is essentially trying to protect that gorgeous barrier.
Yeah.
That barrier that's not working anymore, it protects it. And that's the most important thing to do. And it's finding the right moisturizer that they like. And kids are like, oh, I'm just going to run away. I don't want the moisturizer. I don't like the big, thick, gloopy ointments because it's horrible. Then they find the moisturizer that they like. Those 3 I've recommended are ones that, children quite like. And if you get them when they're wet, put it all on when they're wet, and then pat them dry. It's easy. You can just put your pajamas straight on after.
So it's not as thick then, is it, for them when they're wet? Yeah,
exactly. And then when anything is red with the eczema, the key is to get the steroid cream on it. The key is not to be frightened of steroid creams. It's to be used under supervision. But you think of it almost like a little forest fire. Anything that's red, you want to put that out, because otherwise it just gets out of control. So that's really the basic way of looking after eczema.
But again, is eczema not connected to a gut problem, something that's not working in a child?
What's not working is the barrier of the skin. So eczema
But why wouldn't your barrier of skin just not work?
For 2 reasons, really. One is that it's just not developed yet properly.
Yeah.
And so because it's not developed quite right yet, and that's why often kids will grow out of it, because it strengthens up over time. And because we live in a world where there's lots of things around to irritate it, and we're very clean freaks, so our kind of microbe safari slightly different. So that's one reason. And the second reason is this very, very common genetic mutation in a protein called filaggrin that makes up the skin barrier. So that's why if you've got a parent with eczema, you're more likely that your child will have eczema, because they've inherited that tendency.
Of the gene?
Of the gene, yeah.
Wow. So on the show, what is the worst thing you've seen?
So we are on series 8 of the show
now. I bet
now.
you've literally seen everything.
I feel like I've seen everything as a dermatologist. Yeah. Anyway, I haven't seen everything. I mean, I haven't, but I feel like...
What haven't you seen then?
I mean, there's some very rare genetic conditions that I haven't seen that... I mean, I haven't seen more than I've seen, but I've seen a lot. So what would I say? So we've filmed 8 series of this TV show, and every series has about 10 episodes, and every episode has 4 patients. And in every episode, there's 2 gory stories and then 2 stories. And the gory is where I do the operations, and we'll remove things like big lumps from people. We will remove big cysts. There's lots of pops, and we'll fix their leg ulcers, and we'll do operations on lumps and bumps. or skin
I
cancers.
feel like it would be my dream job too, though.
Oh, it's so good.
I would love to, like, I'm a picker.
It's
Do
so
you know what I mean?
good.
Like, oh, I'm just, but I was terrible as a kid with even picking myself and doing things. And
I think that's one of the first things you have to be as a dermatologist. Are you interested in picking your own skin? If the answer is yes, then you get accepted.
this is the job for you.
This is the job for you. And then the other two patients are stories where they've had a really, terrible skin condition that's affected their lives, and they've never had a diagnosis or they've never had any treatment for it. And they're very emotional, those stories. So I think that's why the show's done so well, because it really helps people understand the emotional impact.
Where would
of
you
skin
be, though,
disease.
to not get a diagnosis on it?
Oh, in this country.
What? Because it's just...
Yeah, well, just because access to care, access to the right treatments for care, and the amount of time it now takes for many people to actually get in to see a dermatologist. I think things are picking up and getting a little bit
What would your
better
wait list be for the NHS?
Everywhere is very different, and it depends on the severity of the condition. But, in some places it's 2 years, and then you go to the bottom of the list again, especially for conditions which are considered benign and cosmetic and you don't have to treat. Now, last week we removed a lump from a young mum's face, so the side of her eye, and it was the size of a snooker ball. And she had had that for 7 years, and she'd been waiting to try and have that removed, and she just kept getting put to the bottom of the list. No, I'm serious. And it was classed as cosmetic and benign. And yes, she would get it done, but she just had to wait.
I'm sorry, I've got a snooker ball on the side of my face. Can you get this off?
Yeah. And so you can imagine the difference. I mean, she was only young. She was only about 28 years old. But the striking stories, which, going back to that question you asked, are... I mean, there are so many, because you have to be fairly severe to make it to get on the show in the first place. But I suppose the one
you can't just be the person with the spot at the end of the nose.
Although there was actually a very interesting little spot at the end of the nose where it turned out to be something called a little lipoma, which you never see on noses. So that was just a very kind of quirky diagnosis. But I think the big cases are, if we think about a condition called psoriasis, there was a young girl who came on the show who had psoriasis. And psoriasis is a multi-system disorder, so it causes lots of inflammation, not just in your skin, but also in your joints. It can impact your cardiovascular risk factors, and it has a really negative impact on how you view yourself and in terms of depression and your quality of life. And this girl had...
It is just frustrating as well. Like the frustration they feel, and then when it's flaring up and you're having an episode, is just like, I feel for people with skin conditions, because... it's so visible, isn't it?
It's so visible. It's, it's right there for everyone to see. And, we as humans are judgmental at the best of times. And we currently live in the worst of times, and we are so judgmental. And we're just forming opinions on people immediately. And I understand why that happens. Evolutionary kind of sense, we want to seek out people that look healthy. Like, that's kind of natural instinct. But for people who have a skin disease, they are just constantly aware of that, and constantly aware of how people look at them, how people treat them. They're overlooked for jobs, they're overlooked for promotions, they're overlooked in relationships, and then they have that impact on themselves. And how do you get out of that? It's, a lot of people embrace their skin disease and use it as their kind of defining kind of thing and make their way in the world because of it. But
you can understand the people that
but
can't
the vast
do that.
Majority of people can't do that. And I mean, I just feel it's so sad, really, whenever you see a very young person and what's holding them back, and being able to find the right thing then to give them. And it's annoying whenever it hasn't happened. So this young woman with psoriasis, she had been told there was nothing else could happen for her. And, but with the right understanding and the right treatments, which she then got put on, her psoriasis is clear, her joints are clear, she's taken her little one to school. It is life-changing when people get on the right treatment.
But she had to find you to do that.
Well, she had to find a dermatologist with access to the treatments, and where she happened to live, it just didn't.
So it does fall to where you live, what stuff you can get.
It definitely falls to where you live. It definitely does. If she had have lived in London, I knew she would have got the right treatment on the NHS much more quickly.
Because we've just got more in London here.
Yeah, or it's not always London, but there's just certain areas where the pathway of care is set up much better to help people who sometimes aren't able to advocate for themselves. You know, if you've got private health insurance, you're sorted. If you are very, very pushy as a person who's going to use the NHS services, typically you're sorted. But if you're somebody who's a little bit quieter, a little bit more shy, a little bit don't want to rock the boat, and no one's advocating for you, and you're in an area where services are not really great, unfortunately, that's the group of people who really fall to the wayside.
And this is what I always say about the NHS. And I had to have a massive dealing with the NHS for 18 months. And you have to have a voice within there, and you have to be pushy, and you have to go in and just keep on and on and on until you're heard. But I get it that if you are a quiet person, how are you doing that? But for anyone listening to this that is going through anything with the NHS, you have to be as loud as possible, because you can get overlooked.
Yeah, and you know what? I agree with that.
This is from an NHS doctor.
It is. Yeah, so I work in the NHS. I work in an amazing facility with amazing colleagues and an amazing team treating skin cancers in the NHS. And we are incredibly busy, but it is a very incredibly well-run service. And it is very annoying when people are constantly being pushy and constantly.
But you have to be, don't you?
But you have to be, because I see the other side of that, where if some in our area, it wouldn't matter, because you know
you're seen.
You're seen and you're treated and you're given really excellent care. But in some cases where the clinics aren't local, people don't really know how to refer around, people don't want to refer around, those services aren't even offered in some areas, then it is definitely much more difficult. And they're 100% the areas where you need to, no matter how shy you feel or how much you don't want to advocate for yourself, you need to push it.
Yeah. Keep knocking on the door, keep sending the emails, keep calling the receptionist. So computer says no. No, the computer needs to say yes today, please.
But I even find it difficult. You know, I am an NHS doctor, and understanding how sometimes services work, even for myself and my family, as you navigate the system, it is difficult.
So you give advice on social media and tips. Are you seeing a lot of people out there that are giving good, bad? What are you seeing across social media and people advising others for skin?
I mean, it is a minefield. And what is so difficult is that some of the advice given is absolutely amazing, and some of the advice given is absolutely terrifying. I think it's really good that people are deeper thinkers about issues. I think it is amazing, and I think that
sometimes we don't question, do we? And we just go, "Oh, yep, we're being told to do that. Let's all go and do it." Whereas I've completely come out of my way of thinking how I thought before.
I think that's honestly exactly spot on. And if you look really harsh at what the skincare industry is and the things that are said about it and the claims that are made, you know, quite a lot of it is stretching the truth. You know, this cream is going to get rid of your wrinkles. No, it is not. No. You know, temporarily it might look slightly better, but it's an absolute nonsense to say that cream's going to get rid of your wrinkles, because it just won't. Or, you know, so I think we do have to very much question what is presented to us. I completely agree with you. In fact, just this morning we were talking about these interventions that we could do to ourselves and whether they make a difference or not. But it's about backing the right horse, and it's about backing the horse that has, in my mind, the science behind it to say, okay, well, I'm not going to do that, and it's for this reasons, and I'm not going to do that, and it's for this reasons. But it has to make sense over evidence and research to say that's nonsense.
Also, I think as well with science research, like obviously what you've learned about the skin and everything, like you've studied that, but there is so much more as well that we don't know, and we're all cellular. And I just believe I'm just on a different path, like to how I believe us as humans should live and who we are. And to know, I'm just a bit out there now. People be like, oh my God. Do you get what I'm trying to say though? That I just feel we are we're so conditioned, aren't we, to believe. Like, and I love getting like someone like you on that goes, that you're not just a doctor that goes, this is what you should do and blah, 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 and don't look down this path and don't look down that path. Like, you're quite a 360 person that's looking at everything. Whereas like some doctors you talk to, they don't even know anything about diet. And you're like, how can you be given advice, but you're not even telling me about a diet?
I mean, I think that's right. We sometimes regard it now as almost medicine 3.0. So we had medicine 1.0 at the beginning where it was very rudimentary. And then we went through a phase of, this is the disease and this is how we fix it. Whereas now we're in a realm of the world where, yes, we understand more about disease and we are so amazingly lucky about all of the different treatments that we have for disease. But we're all starting to understand a little bit more about how to prevent these diseases in the first place and how we can look after ourselves as an organism in its entirety so that our health is better across the board. So there's no point just looking at the skin and not addressing things like, well, how are you sleeping? Do you sleep well every single night? What is your stress levels like at work? What kind of food are you eating? What kind of stresses are on you in a family sandwich? Have you got to look after parents and children? There's no point in just giving somebody a drug for acne and saying, oh, off you go, have this isotretinoin. I mean, you need to know the skincare that goes alongside with it. So this is a world now where you have to understand all of those things to make it better.
Because do you know what? It's funny. My cousin, we maybe don't keep this bit in, but my cousin had really bad acne, and his mum just went down the route straight away of what is it called, the
Roaccutane, yeah.
But now he's getting such bad like cysts coming out, and I was like, but that's because I feel like his immune system has actually just been suppressed by whatever it is, and it's trying to expel itself somehow. And he had to have like a massive cyst cut out. Obviously, what you're doing on his bum.
Yeah. I did one of those last week, actually.
Yeah, his was like really bad. And then he just went, before he went on holiday, he got another one come up and he was going to Portugal on his lad's holiday. But he didn't actually have that one cut out. But do you think because it's suppressed, like it needed to get out?
Well, that is, I mean, I'm not sure where he is in his Roaccutane kind of journey.
He'd done it. It was like years ago. He had it. Young, he had.
So when people have acne, they have something called, it's usually a follicular occlusion. In other words, genetically, you are prone to clogging off your follicles. Yeah. And there's genes involved in this and why this happens. And for some people that presents as acne, for other people it presents, in the armpits and groins. And for some people it presents as developing lots of little cysts and boils everywhere. And sometimes it overlaps. And the Roaccutane is amazing, or isotretinoin. It's a vitamin A drug. It's used in a number of different ways to essentially clear acne. It's an incredibly effective drug. It's not without its side effects.
Yeah, because it's powerful, isn't it? It's quite a powerful drug.
It's a very powerful drug. It is our most powerful drug for clearing acne. And it is, I think, life-saving for so many, young people. But it has side effects, so it needs to be monitored in a controlled situation. But even after that's cleared and gone, for some people, they still have this kind of tendency to block things off. And so sometimes actually we'll put people on that drug on a very, very low dose, just so they stop getting those cysts and boils coming. Because otherwise you just end up cutting them out. So you can just have that vitamin A, but having it in a lighter dose as well. So he might find something like that helpful.
Yeah, he needs to. And also, I think it's a bad age, isn't it? Because when you're out drinking and do whatever, like we're saying, you go out one night drinking, you come up with a spot. Well, in your 20s,
yeah, and in your 30s,
that's your time to.
Yeah, and and in your 40s, and we see, especially women now with acne, there's a huge increase in what we call female onset acne, and it happens a bit later, and
like 40s.
Yeah, exactly, and it often coincides with the perimenopausal period, after pregnancies, coming off oral contraceptive pills, and slight imbalances in hormones, and that is something that's related to lots of lifestyle factors, kind of going back to what we were talking about. Yes, hormones play a role, but your sleep plays a role, your diet plays a role, all of these things play a role, and fixing one is not normally enough. You have to address all of those issues.
Fix it all. Yeah. Wow, thank you so much for coming on. I feel like this was your podcast before when we could have spoke for hours about it. Thank you so much.
Pleasure. Thank you for having me.
And we'll be back with another episode, same time, same place, next week.